it. Now, a safe drug use advocacy group, Harm Reduction Alliance Ghana, has appealed to government to reduce treatment fees for drug addicts seeking rehabilitation. As the world marks No Tobacco Day today, it is estimated more than 5,000 people die annually in Ghana from tobacco-related illnesses. According to the group, it costs averagely 2,000 Ghana cedis per month to seek rehabilitation, and that may be negatively affecting the fight against drug use in general. Michael Ashali has more.
World Tobacco Day is celebrated annually on the last day of May. In Ghana, it is estimated that more than 5,000 people die from tobacco-related illnesses annually. According to a safe drug use advocacy group, Harm Reduction Alliance Ghana, it is important that government adopts fresh strategies to reduce the mortality rate. Specifically, the group is asking government to rescind its proposed plan to ban the use of e-cigarettes. They believe such a move will negatively impact the fight against tobacco use. Samuel Kujo Hanu is the executive director of the group.
Just like we can't have a crime-free society, we can also have a drug-free society. Unfortunately, some people are pushing and still pushing, and now they are scared about the impact of electronic cigarettes, which is e-cigs. But we are saying that there is no evidence as to the long-term effect of e-cigarettes. So we have to be very careful in banning or saying that completely we don't want e-cigs in our system, because by doing that, we are rather pushing people to go back to the using of combustible cigarettes. 3.5% of the adult population of Ghana are smokers. This will result in like about 5.012 dying every year from tobacco-related illnesses. It is therefore important for Ghanaians to know the health implications of tobacco smoking while also advancing tobacco harm reduction as a viable public health strategy. Electronic cigarettes could allow some smokers to progressively quit smoking. Public Health England maintains vaping is 95% less harmful than smoking. We believe that it is important to implement harm reduction as a part of government's public health strategy to ensure that citizens live healthier lives. We therefore ask that tobacco harm reduction be considered as an integral aspect of government's public health approach.
Averagely, it costs 2,000 Ghana cedis to access treatment for drug addiction from any of the 3 public rehabilitation centers in the country. Samuel Kujo Hanu believes increasing the number of rehab centers and reducing the cost of treatment could encourage more people to seek help.
I can list a number of them. There are a lot of so make treatment available for people who are addicted. So we make the treatment available, make it affordable. As I tell you now, rehabilitation in Ghana is expensive. The average Ghanaian cannot afford it. I mean, if you have to go for rehabilitation, you have to do it like for 6 months. And averagely, even in government facilities, they are charging you 2,005 Ghana cedis a month. Average Ghanaian, how many of us can afford that? So let's make treatment now. And if you go, only the 3 psychiatric hospitals, Accra Psychiatric Hospital, Pantai, and Akafo, that are giving treatment services. The other ones are private. Are we not supposed to have rehabilitation centers in all over the country so that people can have access to them? So make treatment facilities are accessible, affordable.
The group hopes some of these proposals will be factored into the Narcotics Control Commission bill. For JoyNews, Michael Ashali.
Let's get onto the phone and talk more on tobacco use and how we can reduce its use. And I'm joined on the phone by Executive Director of Harm Reduction Alliance Ghana, Samuel Kujo Hanu. I'm grateful for your time this morning. I mean, you seek that the country reduces the cost of treatment for people who are addicted to tobacco. It's not that easy, but first let's look at how dangerous or what the situation looks like, the situation that we're dealing with.
Okay, so thank you very much for having me, and good morning to all your viewers. So what we are talking about is not only for tobacco treatment but for all substances of abuse. Yes, there's no doubt about the addictive potential of nicotine. And a number of Ghanaians are not only addicted to nicotine, but to marijuana, alcohol, and other substances. And we are saying that sometimes the cost, the accessibility, and affordability in Ghana is an issue. I mean, most people, apart from the 3 psychiatric hospitals that offer some kind of rehabilitation services, majority of our population are not covered. And there's a need for us to make treatment affordable and accessible to all Ghanaians so that people who are addicted to substances can go for treatment and return back to normal life and help in the development of the country.
What is the situation as we speak? You talk about the reduction of treatment fees. What is the situation?
Well, the situation is that normally, so this is how it looks like. People who are addicted to substances, it is described drug use or substance use disorder is described as a brain disease. So it has an effect on the brain. So we can't compare it like we are treating like malaria or some acute illness. Substance use disorders are chronic conditions like you can compare them to like any mental health condition. And when we have to treat somebody, the person needs to go for rehabilitation for sometimes 6 months minimum. You know, they have to pay in the so 6 months means that if even we are paying 2,000 Ghana cedis a month or 2,005 Ghana cedis per month, you can imagine 2,005 Ghana cedis per month for 6 months. That's 30,000 Ghana cedis. I mean, how many Ghanaians are able to afford 2,000 out of their salary to pay for the service of rehabilitation for their brothers, for their siblings, whatsoever. So we are saying that government needs to come in and intervene and support the facilities that are rendering these services. That people, the services that we have they render there can be more affordable, so that people can go for treatment. Because that's the harm reduction. When we reduce the demand for drugs, it improves the system, and people will not go back to drugs.
But let's look at the root cause. Why would people get addicted to tobacco products? Do you know?
Yes, I mean, I can't tell you for a fact that this is the main cause. The causes, we have a number of factors that we attribute are responsible for people using drugs. Some of them are genetic. In fact, there's so much overwhelming evidence that shows that drug use runs in families. But that doesn't mean that if somebody is addicted to drug in your family, it means you are going to become addicted automatically. But you have the high potential or the high probability of you also having drug use problems. We have people pretending and portraying a social media lifestyle where everything looks nice and beautiful, you know, and we are having young people following these role models. And if the role model, dresses up and holds a cigar, they also want to dress up and hold a cigar, you know, and also have a sense of belonging. People are having issues with, like young people who use drugs. Sometimes they are curiosity. They want to try it. They want to try what it is. They also want to have a sense of belonging to their friends. So the causes of why people use drugs are varied and numerous. And the science tells us that because of the genetic basis and the other factors, these things come together to predispose somebody to using drugs.
Let me speak with Agent Frimpong, who's also joined us for this conversation. He is a former tobacco user. I'm grateful for your time, Mr. Frimpong.
Yeah.
Now, how did you get addicted to this, and how did you even come out of it?
Yeah. I started with marijuana as the peers when we were in secondary school. We were smoking, because if we were not smoking, we would not take part of our group. So I started with marijuana. Then from there, I graduated to the using of heroin. That was after I traveled to Lagos. I left Lagos for the upper part of the country, Maiduguri. And then there I met a girl there who was using. Then he introduced me to the using by adding the heroin to the marijuana, a system we call cocktail. Then I started using. I found out I was feeling fine. Then I used it for so many years over there in Nigeria. Then I have to come back home because of the money that I was using over there. All the money that I was making over there were going into drugs. And I found out that no, I'm wasting my time over there. So I had a wife. He came back. He came to me over there. Then we gathered our things and came back to Ghana. I stopped using when I was in Ghana for some time. Then when I gave my employment back, money started coming. I started joining the other floats again, and then I started using again for so long. I was not using heroin alone. I was using the crack. And in fact, I used it for a long time. For almost 10 years, I was using. And I have to go from a bunker to a bunker, finding better, stuff. Because you go here, you use the stuff for some time, and when you use it doesn't have any potent effect on you again. So you have to travel to another place. So in Ghana, most of the areas they smoke, they know me by a certain name. Okay. So I found out that no, I was losing my social responsibilities. I was not respected at the work side. My parents were not giving any attention on me. I found out I was becoming a useless guy. I sometimes neglect my personal hygiene and other things. So
you decided to stop.
Can I continue?
Go ahead, Mr. Frimpong. So
okay.
How easy was it for you stopping from using tobacco products?
Pardon?
I'm saying that how easy was it for you when you wanted to stop?
It wasn't easy. I have to join a rehab.
Okay.
At a very expensive, amount. Because I tried to stop at home. I stopped and I get back. I got back into it again. I stopped 3 times when I was at home until I find someone who introduced me to a rehab.
Okay.
Then I joined them. It was there that I came to know about really what is drugs, then what drugs are dealing with the human being. But I studied so many things over there, and I found out that no, this is the time I have to stop. So by the help of some books, there's some teachings, and so many things involved. I draw, a recovery plan, and it works for me very well. And now I'm a man in recovery. Let me put it that way, because recovery is never, it's not attained one day. It's forever. So I can't say I've recovered from drugs.
Fully
recovered.
recovered.
Anything at all can lure you back to the drugs again. Only to stay sober, then continue with my life.
But you are better off than before. Congratulations, Ajin Frimpong.
That is why I'm saying I'm in recovery.
You've really done well, and keep it up. Let me go back to you, Mr. Kujo. What's the role of your outfit in actually getting government to reduce treatment fee for these addicts?
Please come again. I didn't get up.
I'm asking what your outfit, your role, the role that you seek to play to actually help reduce the treatment fee.
Yes, so, so just like we are doing, we do a lot of advocacy to advocate for services for these people. In fact, we sometimes conduct outreach programs where we go to the drug-using communities to engage them and to provide them with a number of services. Sometimes we even register them on the National Health Insurance Scheme so that they can have access to medical treatment, and that is for free. You just register them and get them NHIS cards that they can access treatment. The last time we were with them, we screened a number of them. Some of them were having HIV, some of them were HIV positive, some of them were having hepatitis, some of them were having malaria and other conditions. So we also provided them with some free medication. We got some support from some of our friends, and we give them free medications. We even facilitated some of them going for reviews, because we can't just leave them if they're HIV positive. We can't just leave them. We have to refer them to appropriate treatment so that they can be on treatment. So we are doing a lot of advocacy, and we also say that drug use should not be criminalized. The war that we are waging on drugs is not helping anybody. It's rather war on the human being, And now it's looking like now the world is now trying to wage a war on vaping. I mean, which we think that it's a reduced risk as compared to the normal tobacco smoking. So this is the kind of advocacy.
I'm grateful for your time, Samuel Hanu. He's Executive Director of Harm Reduction Alliance. We're also joined by Ajin Frimpong, who is a former tobacco addict, with some advice.